So good morning, everybody. Celebrate is absolutely the right word. Today is a long day coming, and it's one that should fill everyone here with pride in what we have and what we are about to accomplish. It's my honor today to stand up and recognize the many who have worked so hard to get us to this point. First of all, our Board of Supervisors. He's not here right this second, but our Board Chair from the Brooklyn District, Mr. Dan Schmidt, our Vice Chair from the Fairfield District, the Reverend Roscoe Cooper, for right here in the Verina District, Reverend Tyrone Nelson, from the Three Chop District, Miss Misty Roundtree, and from the Tuckahoe District, Mr. Jody Rogish. Personally, I also want to acknowledge and thank our county manager, Mr. John Vitulkas. It was Mr. Vitulkas who first had the vision to create the Recovery Roundtable, which you're going to hear more about. On a personal note, I really want to thank Mr. Vitulkas for the support and the space to strategize, to problem solve, and to be creative, which got us to this date. Mr. Vitulkas never gave up on this project, in spite of some bumps that we had along the way, and I have no doubt that what we are today breaking ground on was the right track for this project. It's worth a comment that the Henrico County Attorney's Office has been amazing throughout this entire process and has really been an incredible partner. I need in particular to call out the hard work of our county attorney, Andrew Newby, as well as assistants Ryan Murphy and Alyssa Brown. There are several members of the Recovery Roundtable here today. If I leave anyone out, I do not do so intentionally, and I apologize for doing so. We do have in attendance today, in addition to myself, who's on the Recovery Roundtable, Judge Craig Duncombe of the Henrico General District Court, Mike Sherman, the Assistant to the County Manager for Intergovernmental Relations, Laura Toddy, Director of Henrico Area Mental Health and Developmental Services, and Leslie Stephen, the Director for Substance Use Services for Henrico Mental Health. It is particularly significant to note that Leslie first came forward to the Recovery Roundtable with the idea of developing a detox center. So we are here today, Leslie, to fill out your vision. We offer a huge thanks to Tony McDowell, who I should slow down a little bit for that, shouldn't I? We offer a huge thanks to Tony McDowell, the Executive Director of the Virginia Opioid Abatement Authority and my predecessor in this role with the county. Tony authored the report of the Recovery Roundtable and put in innumerable hours getting this project started. Tony, without question, we would not be standing here today without your dedication and effort. And I'm going to start the applause for Tony. There were many others who gave their time and energy to the Recovery Roundtable who cannot be here. For example, Dr. Danny Avula, who I believe is a little preoccupied with a few other responsibilities these days. Again, to everyone and anyone I did not mention who served on the Recovery Roundtable, today is a credit to your dedication and to your hard work. The number of county staff who have contributed to this project cannot be adequately recounted. Just about every county agency, including planning, general services, mental health, police and fire, the sheriff's office, real property, finance, rec and parks, schools, and many others have contributed to this project willingly and diligently. Pyramid Healthcare is here, representatives are here, and they have been a magnificent partner throughout this process. There are a number of Pyramid execs who I do want to acknowledge. From Henrico County and from our community partners, we welcome Dan Gelman, who is the VP of Marketing, Bridget Kane, the Senior VP of Operations, Gary Davis, VP of Operations, Colin Rozier, VP of Governmental Affairs, Drew Wallace, Director of Marketing, Connor Violin, Community Outreach Representative, Jeff Davis, and Jeff, you have been amazing throughout this entire process. Brandon and I have talked many times about how we would love to steal you from Pyramid and have you working with us. But Jeff Davis is the Executive VP of Engineering and Construction, Stacy Lampman, Spaces and Design Studio, Jason Hopkins, Design Physics, and Rob Hebb, Legacy Site Civil Engineer. Dan, I'm sure I've left some people out, although that was an exhaustive list, so feel free to jump in and contribute. It goes without saying that our partnership with Pyramid to date and going forward has been nothing short of amazing. Just to provide a little bit of insight into this project, and we certainly will have more time to discuss this over the next year as the physical construction takes place, as well as while we build out our operational model. This model is ever evolving as the needs of our county have continued to change. When we started looking to build a recovery center in Henrico, heroin and opioids were fueling the addiction epidemic. Now we're seeing more potent mixtures of fentanyl and stimulants. The drugs on the street are continuously evolving and require public safety and treatment providers to be attuned to the newest trends. By partnering with an industry leader like Pyramid Healthcare, we'll be able to adapt to the changes as they emerge and offer a range of immediate and short-term treatment that can relieve hospital emergencies and serve as a bridge to other treatment and recovery services available in the community. What is key for this project is that we are looking for long-term solutions for those in need. While someone may only stay for a few weeks at the recovery center, Pyramid staff will develop, with input from county partners, a long-term plan for patients to provide the needed support to achieve stability and sobriety. This will be a unique and exciting opportunity for many dedicated county employees to work alongside Pyramid and others in the community to provide the help that has been so long needed. Before I finish, two more people deserve to be called out. First, I need to give credit to my partner in the development of this project, Deputy County Manager Brandon Hinton. Brandon, it has been an absolute honor to work alongside you on this. You consistently comment to me about my passion and dedication to this project, but my friend, I've seen the same passion and drive from your end. We are all grateful today that the city could spare you to come back and be with us. Finally, I would like to take a minute before I ask him to come to the podium to speak, to acknowledge and thank our Verina Supervisor, Reverend Nelson. You're going to hear today and over the next year about how the Recovery Roundtable and the center began actually as a concept for a third jail. Reverend Nelson and I, and we were actually talking about this a few minutes ago, Reverend Nelson and I sat in his office at his church back in 2019 for literally hours discussing the county and our residents' needs and how best to respond. As we talked, the humanity and the concern that Reverend Nelson maintained throughout the entirety of this project became more and more evident. I remember like it was yesterday, Reverend Nelson looking me in the eye and saying, jail cannot be the answer for people who need our help. We have to find something different, and today is that something different. That leadership and that dedication to doing what is right is why we are here today. Over the intervening 6 years, the leadership and dedication never faded. So please join me in welcoming to the podium the supervisor for the Verina District, whose leadership made this all happen, Reverend Tyrone Nelson.
Good morning. Excited to be here this morning and to be a part of this groundbreaking. And who would have thought that in 2025, well, I thought it, so let me go ahead and claim it now. We're excited that we're here for this groundbreaking on these grounds for the Henrico Pyramid Detox and Residential Treatment Center. Last night I tried to think of some acronym that we can call it, but HPDRTC doesn't click. So we're just going to call it Henrico Pyramid Detox and Residential Treatment Center. As Mike mentioned, I do want to wind back the clock a few years when our county leadership recognized a need to learn more about substance abuse issues. Many drug overdoses were due to heroin and cocaine. We had not yet been through COVID. Social distancing was an unknown phrase to most of us. In Henrico, we were considering at the time building another jail due to the influx of inmates, many of whom were struggling with opioid or other addictions. In response, we established a recovery roundtable to investigate these issues and consider solutions. It really was a perfect storm of many different things. Our former sheriff was retiring. Our new sheriff, Elisa Gregory, shared many of the same thoughts that I had about jail not being a final solution. We had colleagues on our board who also were open to finding solutions to help people who were struggling with addiction. I was at an event some years ago, and there was a political difference between myself and another person, and the other person then tried to write me out of the history of what was happening. I said that I would never do that. So I do want to mention that my colleague who served the Three Chop District, Tommy Brandon, was also a huge part of bringing this recovery roundtable to fruition. As stated by Mr. Feinmehl, the recovery roundtable brought together health professionals, peer recovery specialists, judges, elected officials, community stakeholders. You heard their name. Just before the pandemic, it became clear that prevention, diversion, and treatment were better solutions than incarceration. And so responding to individuals in the moment saves lives, we figured out. Yet for those who are suffering with substance abuse, additional support is needed after an initial crisis. And so today, we are taking tangible steps to create a medically supervised, safe center in our community for helping people in need. Not only will the Henrico Pyramid Center offer alcohol and drug detoxification, it will also allow inpatient treatment at the same location. Instead of 3 to 5 days, individuals can stay up to 30 additional days with increasing or decreasing levels of care. We know in 2025, heroin and other opioids are being outpaced by more lethal synthetic fentanyl. Fentanyl, found in almost every illicit drug, is often fatal, so waiting a day can result in death. We know the need for medically managed detox and behavioral health treatment is 24 hours a day, 7 days a week. Our first responders, police, fire, sheriff deputies, EMTs, will now have a place to assist people in crisis. Henrico Area Mental Health and Developmental Services will have same-day access to this center with a seamless transition to more community supports as individuals progress through ongoing treatment. Partnership among agencies, providers, and county leadership is resulting in a bigger win for all of us. Together, we can help more people as they become connected with community supports, resulting in long-term success. Here in Henrico County, we are focusing our efforts on saving lives through building this recovery center. We are responding to the needs of our community. We are driven by a desire to serve everyone. This recovery center demonstrates once again that Henrico is a county with a heart. I do want to thank Mr. Feinmehl and Mr. Hinton, both who put in countless hours, in particular Mike, who has led this project. I want to thank you for not giving up. When we wrestled to find a partner, when things sometimes didn't always seem to be as optimistic, our county manager, who continues to encourage his staff to think out of the box and to care about people over process. And all of you who have partnered with us in some way, shape, or form, we are who we are because you are what you are. You are who you are, and you do what you do. Finally, I want to thank Pyramid for being our partner. We appreciate you. I shared this morning. This has to work. This cannot fail. And then I'm excited about the possibility for the people who won't have to go to jail as a first option, but who will get treatment and get care. And I'm glad to be a part of a county who can put forth such effort. Thank you to the Empower Henrico Task Force and the community members on the board. Thank you to the residents of Henrico County for making this a place of hope and urgent therapeutic treatment, no matter one's income or resources. Most of all, I thank all of you for being here today. Your presence demonstrates your care and your commitment to our community and to our lasting recovery. I think I'm turning this over now to our leader from Pyramid.
Thank you, Reverend Nelson. Good morning.
Good morning.
So, more than 3 years ago, Henrico County began engaging treatment providers in a conversation about the creation of a facility that would be a critical part of their plans to combat the opioid epidemic and the impacts of addiction throughout the community. When Pyramid Healthcare heard about this, we were immediately super passionate about becoming involved. And we started doing some research into what the current predicament was in the county. Our research showed that overdose death rates and opioid-related emergency department visits in Henrico County were among the highest in the state, well above state averages. Feedback from the county revealed that over 100 individuals each month were receiving detox and treatment services from within the jail system at a significantly higher cost to the county and in a far less appropriate setting than in a facility like we're talking about today. The overall economic burden due to the opioid epidemic had grown to $274 million per year for the county alone. That's 40% above the state average on a per capita basis. There seemed to be a perfect opportunity for Pyramid to take part in the conversation and offer assistance. We became highly motivated the more we talked about it to become involved as more than just the operator of the facility, but also work together on the design and the construction of the facility. So last August, Mr. Feinmel and myself started having some very serious conversations about moving the project forward and about how we could approach the project in the most impactful and cost-effective manner. As we discussed a shared vision, we became more passionate about like I said, not only the operation, but the team has worked very hard to come up with the design that I'll share the details on of the facility that'll be located right where we're standing. Ultimately, the county agreed with many of our recommendations, and we decided to move forward, and that brings us to today, which is the culmination of a lot of passion, dedication, and hard work. And because of that, I'd like to recognize a few people. First and foremost, the County Board of Supervisors, particularly Supervisor Reverend Tyrone Nelson, who just spoke. Thank you so much for your ongoing support of this project throughout the process. The County Manager's Office was obviously instrumental. County Manager John Vakulis, and then Deputy County Managers Mr. Michael Feinmel and Mr. Brandon Hinton were instrumental in working alongside us every step of the way. Not only did they become partners on this project, but colleagues that I'm proud to walk alongside as we move forward. Finally, I'd like to also thank Tony McDowell, who was around at the very beginning of this project and took part in forming the initial vision for what today would look like. So I'd like to share a little bit about Pyramid Healthcare. Pyramid's a 25-year-old organization specializing in the treatment of behavioral health services, really with the mission in mind of creating unparalleled access to care for high-quality services, high-quality treatment services, particularly for the underserved client. And that's clients that have no insurance, no resources, potentially Medicaid, but are very much underserved. And that's been the core of our mission for the last 25 years. Since the late 1990s, our organization has grown. We're now in 9 states. We have over 80 treatment locations. We have a number of other treatment facilities just like the one we're talking about today. All told, we have 2,100 inpatient treatment beds. And on any given day, we serve over 14,000 active clients. We are extremely proud to be able to bring that type of experience and expertise to this partnership with the county so that we can provide those same services here. In the last 25 years, despite that growth, despite that scale of operation, it always comes back to the mission for us, and it always comes back to that specific type of client who's underserved and has nothing, no options, and has significant barriers to accessing care. And I think in partnership with the county, we've come up with a significant solution to that. So at this point, I'm proud to be able to share the details of the facility, a little bit more detail than we've given so far. The program, the building itself will be located right where we're standing. It's over 24,000 square feet with an additional 7,500 square foot gymnasium just adjacent to the main building. We'll have 60 treatment beds, 10 of which will be withdrawal management or detox, and the remaining 50 will be for substance use residential, where clients can stay for up to 30 or potentially more days, which will provide immense value to the county and to your residents. The construction is set to start soon after we wrap up today, early summer, and we should be wrapped up with construction by next spring, next March, with an anticipated start date of mid-summer to begin treating clients. We're extremely excited to be able to start serving clients. And again, in partnership with the county, there's a number of different concepts that are very central to the success of our program. One of which would be the idea of creating access that doesn't currently exist for clients to receive treatment locally. Henrico County residents will have 24/7, 365-day per year access to care by calling one phone number. We typically bring people into treatment within a day, generally within hours of that initial call. And for Henrico County residents, they will have priority access to those 60 beds. If there are no beds available, Pyramid currently operates 312 other beds in the state, and we'll provide transportation to any one of our programs for treatment services and then back to home or back to the next destination afterwards. We are absolutely committed to walking alongside our partners at the Henrico area Mental Health and Developmental Services, throughout Henrico County law enforcement and all local criminal justice entities. We will be partnering with Henrico County first responders and local hospital emergency departments, and then of course the Empower Henrico Task Force and other dedicated local providers. Our goal will be to come up with a set of protocols to ensure fast access to care and appropriate transition to aftercare treatment for recovery housing and other recovery services, as well as treatment post-discharge from this facility. This way, individuals will be set up for long-term success in recovery, as well as success being productive members of the local community. So ultimately, this facility will have great impact on the community in a number of different ways. And one, I go back to one of the first things I said, we'll provide a financial savings based on individuals detoxing in the right place at a lower cost versus in hospitals and in jails. Secondly, we'll support the local economy with approximately 60 jobs and of course tax revenue. And thirdly, we see this facility being the absolute hub of the recovery ecosystem that is the vision for so many of us here today. We plan on providing a very critical part of that treatment continuum and continuing to that overall solution to combating the opioid epidemic. So with that, I'd like to thank everyone for coming today. Really excited to get started on this project, and I thank you again.
And 1, 2, 3, toss.